Well, we're back right here in the studio, and we have with us right now Dr. Faatima Hadi, who's an adult advanced heart failure and cardiac transplant and pulmonary arterial hypertension cardiologist. Dr. Faatima, welcome to our program, Ya Hala Kuwait.
Hello, and thank you for inviting me to your program.
It's a pleasure to have you with us. And Doctor, can you briefly explain what is pulmonary arterial hypertension, PAH? What is it?
Pulmonary arterial hypertension is merely, it's a rare disease, but we're thinking right now that it's not that rare. It's a progressive disease, and it's due to an increase of pressure in the pulmonary, or what we call it, the lung vessels. And by increasing the pressure in the lung vessels, the right side of the heart will have to work harder and harder, and unfortunately it eventually fails at the end.
So doctor, now what are the most common causes that are contributing factors of PAH?
It's actually idiopathic, what we call it idiopathic. Idiopathic means that we don't have any identifiable cause for it. And in 10 to 15% of the idiopathic cases, we've linked it to heritable causes, which means that it runs in the family and it has some specific genes that might be linked to the disease.
So, genetics and lifestyle components are linked to PAH then?
Genetic, yes, but not lifestyle component necessarily. It can be linked to other diseases though, like connective tissue disease, liver disease, and HIV. For the environmental causes, I don't think there is any environmental cause that's linked to the disease apart from some of the drug abuse like methamphetamines mainly, and some of the drugs that cause anorexia, but those drugs are now obsolete and not in the market right now.
Okay, so how does PAH relate to other health conditions like heart or lung diseases?
Actually, PAH is oftentimes mistaken for either a heart or a lung disease.
Yeah.
And
clarify that, please.
And the patient's journey is pretty much long, and even in the best case scenarios in the like US registry, the patient waits for more than a year until he or she gets diagnosed. They will see 3 or 4 specialists, maybe by the 5th specialist, then he will get diagnosed. And in younger population, they might mistake it for bronchial asthma. And in older population, they might mistake it for heart disease because they have symptoms that overlaps with lung and heart disease.
So it's very hard to diagnose them?
It's actually very hard to diagnose.
Okay.
And usually most of the symptoms are very vague.
So what are like the early warning signs of PAH that people out there now watching should look for, Dr. Faatima?
Okay, so the most important sign is breathlessness, that you're unable to do what you used to do in the past. And I don't mean that you have very hard breathing or you breathe very heavily. It's not necessarily this way. It's just you being unable to do what you used to do. Sometimes when you're like, if you're a jogger and if you jog like 5 miles and only being able to jog 1 mile, although that you keep jogging for a mile, this is some of the warning signs that you're not able to do what you used to do. You're fatigued most of the time. And in the later stages, unfortunately, you might have something called syncope or pre-syncope, where you almost lose consciousness with exercise or with doing any effort. And at the end, when the heart fails, when the right side of the heart fails, you will have some kind of swelling in the legs and in the ankles.
Okay, so it's very serious then, doctor. It can get to a serious part.
Yes, it's a deadly disease if left untreated.
Okay. Well, I'm glad you're here with us to clarify some of these things. So when should someone seek medical evaluation for persistent symptoms like the one you mentioned, fatigue or breathlessness?
Sorry, I didn't...
So when should someone seek, let's say, medical evaluation? See a medical doctor when they have some of the symptoms like you mentioned?
Of course.
Which could be for many things like you said, but when should someone go in if they have fatigue or, they're not breathing?
So if they have persistent fatigue, like if you have fatigue due to any illness like flu or viral illness, that's explainable. But if it persists for more than a week or 2, if you do have a family history of similar conditions, if you're a gene carrier, you're known to be a gene carrier, you're from the patient where we call it high-risk patients. Those are the patients with liver disease, patients with connective tissue disease. They should seek help when they have these symptoms like fatigue and breathlessness.
So are there any screening methods for high-risk individuals? Anything they can do?
Of course.
Tell us about that, please.
Echocardiography is by far the most common, readily available screening method in this disease. We can also screen for other diseases that have similar symptoms, like bronchial asthma, like lung diseases, like heart disease. Echo actually will tell us if there is heart disease from the left side or the right side. Pulmonary function test will tell you if there is any pulmonary restriction or lung restriction like bronchial asthma or lung disease. We can do some biomarkers for those patients, and actually we can identify a good amount of those patients by like screening those patients with echocardiography.
Okay, great to hear that. So how important, Dr. Fatima, is early detection in managing PAH?
Actually, it's very important, early detection and early managing PAH. There have been many studies that studied the early introduction of PAH-specific therapy, what we call the therapy that's specific to PAH, and delay 6 months in starting or adding a new drug is associated with increased mortality, meaning that the patient will die sooner if they don't start medication as soon as possible.
So that brings me to my next question. You said medications and so on. What are the current treatment options available, please?
So there are many treatment options available. First, what we call the oral therapy, that like you take pills. Those are the three main groups of those pills are what we call endothelin receptor antagonists, phosphodiesterase receptor inhibitors, and prostacyclin receptor agonists, and guanylate cyclase receptor agonists. Those are the main families of medication. They have serious side effects, but we have to tell our patients, if someone with cancer will get chemotherapy, even though that chemotherapy has serious side effects. So we don't stop medication, because actually pulmonary arterial hypertension has worse prognosis than most cancers, maybe apart from lung cancer. So we need to start the medication even though they have very high side effects or very bad side effect profile, but we tend to treat those side effects to keep going with those medications, because those medications, they save lives.
Okay, can lifestyle changes play a role in managing the conditions, or that's not part of it?
Actually, lifestyle changes is very key in the sense of having observed exercise program. It should be observed by medical personnel. Having a patient group, patient support groups are extremely crucial, and having the family support is very crucial in any chronic condition.
So Dr. Fatima, what is the long-term outlook for a person diagnosed with PAH?
So traditionally, they used to say, you're not going to live more than 3 years. But now with the new medications, with the advance in medication in PAH, we find our patients live long enough to have diseases of elderly.
Okay.
So it's pretty much good if the patient is well treated, if the physicians are aware of the warning signs where we need to do more than just medication. We need to go for lung transplant in order to replace the lung vessels for a better new ones, because this would save their lives. That's what they would be looking for. They will be looking for that it's a progressive disease, but we do have a lot of advances in the medications. And when we have those medications, the prognosis is better.
I think we need a lot of more public awareness, doctor, for people to know. So how important is it to raise public awareness on this?
Definitely, we need more public awareness. We need people who understand that this disease is deadly and progressive, and we need public awareness for the community, and awareness for our colleagues and fellows in
fellow doctors,
doctors, because most doctors, they don't.
It sounds like, it can be mixed up with different things, so it needs a lot more analysis and experience.
Yes, And I always say, when in doubt, call and ask.
That's true. It's always a good thing to do in general
Yes.
in life. And Dr. Fatima, it's a pleasure to have you with us this evening, and thank you so much for coming.
Thank you.
Thank you very much. We'd like to thank our distinguished guest, Dr. Fatima Hadi, adult advanced heart failure, cardiac transplant, and pulmonary arterial hypertension cardiologist, for joining us this evening right here on the program.